Good day, everyone. I'm Dr. Ayla Esmer Jansuy de Torres, and I'm here to discuss the community diagnosis. The objectives of these lectures are to define the extent and magnitude of health-related and disease problems of a community, to describe the pattern of occurrence of health-related and disease problems by host, place, and time characteristics, if applicable, to identify determinants of these health-related and disease problems, and formulate feasible solution or solutions to the identified problem or problems. Let me start with three case scenarios. A doctor in a busy pediatric outpatient clinic. A mother has just brought in her fifth child, a boy aged 5 years. He has sunken eyes, wizened appearance, wasted muscles, pat belly, ball legs, and skin and bone appearance. The doctor chid the mother for her uncaring attitude and ignorance and scolded her for coming so late. The doctor prescribed a dose of vitamin A and an antihelmintic drug, gives cursory advice on nutrition, and send her away. The case sheet is closed and call out the next patient. And the doctor learned after 6 months that the child died some time ago. And how about a scenario in a busy medical OPD? A 30-year-old mother of three children presents with cough of 3 months duration, loss of weight, hemoptysis, and continuous fever. The doctor put stethoscope to her chest and diagnosed them immediately. The doctor prescribes anti-tubercular drugs, record the notes, and send her to the dispensary, expecting the staff there to give detailed information about the medication. When the child and woman came back a few months later in a worse condition with the same recurring problem. How about in ill-connected village? A male infant aged 8 months suffers from diarrhea. There are no trained health functionaries in the village, and the nearest hospital is 35 kilometers away. The parents, being landless laborers, have no means to reach the nearest hospital. And within 12 hours, the child's condition becomes critical. The mother gives the child some herbal decoctions as advised by the local folk healer. And then the result? Of course, no improvement. Within another 6 hours, the child takes his last breath. So, what do you think of these three cases? It is clear from the above three realistic examples that for treating a patient in the real sense of the word, a doctor has to know more than the clinical medicine. He has to know the preventive and social aspects of diseases, and only a thorough knowledge of principles of community medicine can provide answers to such dilemma. Let me first define a community. A community is a group of people with a common characteristic or interest, living together within a larger society. It is also the whole entity that functions because of the interdependence of its parts or subsystems that I will later discuss, and a cluster of people with at least one common characteristics. It may be the same geographic location, occupation, ethnicity, and housing condition. And for the community core, no, it includes traits like the history, where they came from, the socio-demographic characteristic as to age, sex, the civil status, the vital statistics, no, the quantitative data, no, explaining the population, and their the values, the beliefs, and their religion. And we have the 8 subsystems. So the physical environment, education, safety and transportation, politics and government, health and social services, communication, economics, and recreation. For the physical environment, no, this is the housing condition, the materials used in building houses. For the education, no, it is any act or experience that has a formative effect on the mind, character, or physical ability of one's individual, and it is also a right of every citizens. For the safety and transportation, we have the protective services or the way we safeguard the well-being of the people. And then for the politics and government, it is just the working hand in hand in the community and also the one responsible in delivery, no, of the services to the people. And for the health and social services, no, it is the state of complete physical, the mental, and the social well-being of an individual. And this is also a basic human right. And then for the communication, no, this is the transfer of ideas to all areas of life, no. And then for the economics, this is for the production or the exchange or the distribution and consumption of goods. And of course, for the recreation, no, other word is for fun, no. This is the expenditure of time in a manner designed for therapeutic refreshment of one's being or well-being. So going back with the clinical dilemma, let us differentiate the clinical diagnosis between the community diagnosis. So in clinical diagnosis, history is taken from the patient or family. You will interview, no, a single patient or an individual patient or the whole family. For the community diagnosis, we need to involve the formal or the informal leaders, the stakeholders, and even the whole community members. And to detect sign of illness, we need to examine the patient in the clinical diagnosis. For the community diagnosis, we need to observe, no, in community topographical features, the leadership patterns, the conflicting power groups. And for the investigation, for the clinical diagnosis, we need to do a laboratory test. In community diagnosis, we have a data collection from a secondary survey, a primary data, or a secondary sources and survey. For preliminary diagnosis, for the clinical diagnosis, the doctor's initial evaluation to patient is important. While in community diagnosis, there is a data processing. We need to interpret or analyze the data that was already collected from the different questionnaire. For the explanation to the diagnosis to start the treatment, in clinical diagnosis, we need a medication, a pharmacological approach, a non-pharmacological approach, or somewhat maybe a surgery. For community diagnosis, we need a data presentation, and of course, a community action plan as we go along, no, to present the community diagnosis, no, in that particular community. And for the behavior change for the clinical diagnosis, it should may or may not be needed in a particular patient or family. For the community diagnosis, we need the lasting improvement in community health status, and it is not possible without it. And who is in control for the clinical diagnosis? Of course, a doctor. For the community diagnosis, the whole community is involved. For the follow-up, for the clinical diagnosis, we need to assess, progress, confirm diagnosis change, diagnosis and treatment. And for the community diagnosis, we need to monitor, evaluate, and think if the plan is good for the whole community, and to develop a new action depending on the result of the community diagnosis. So community diagnosis from Porte 2014, it is the process of appraising the health status of a community, including the analysis of the health-related statistics and information on health determinants. So we can get the secondary or the primary data. And from Mahahan and Gupta 2013, its goal is to identify the health problems and needs of defined populations and to plan, implement, and evaluate the extent to which health measures effectively meet the needs. So all the community is involved, not only an individual patient or one household. So the importance of community diagnosis is R, to identify and quantify the health problems in a community on the basis of the morbidity and mortality rates of and ratios. So we need to gather the data, no, nationwide, or the data gathered from the questionnaire in that particular community. Second, identify individuals or groups in the community who are at risk of developing the disease or who need health care. So we have the data given by checking if that is a major problem in that particular community. A major problem is defined if it is a case, no, involved in the top 10 cases, no, in morbidity or mortality, no, nationwide or in the whole country. So there are different types of community diagnosis. So we can use the comprehensive or the problem-oriented community diagnosis. So this time, we need to do the comprehensive community diagnosis by getting the general information about the community. And particularly, we will do the epidemiologic method. So there are four parts: the definition of the problem, appraisal of existing facts, hypothesis formulation, and practical application. So the first part of the epidemiologic method of the community diagnosis is definition of the problem. What is the present status, the nature and extent of the problem? So you may do supplemental research. No, data may be beyond what was obtained from your survey, and to provide a better description of our adopted community. In this case, Barangay West Crame in San Juan is our target to do a survey and to also do or complete a community diagnosis. We should include the topography, the social-cultural background, the political dynamics, or if possible, we have the population pyramid. The next is it a major or minor problem? So major public health problems are the medical conditions that are reported as the leading causes of morbidity and mortality among us, the Filipinos, at the national level. So some medical conditions may be a problem in San Juan locally, but not necessarily at the national level. Okay. The next is how much is the economic cost of the problem. So we had for the next slides, no, we have the sample computations, no, in defining or in computing the economic cost of the problem. Okay. So this is the latest data, no, the number of cases of leading causes of morbidity in the Philippines, no, from the Philippine Statistics Authority 2022, obtained from 2019 to 2021, and the top cause is the acute respiratory infections. So we can apply it, no, in the next in your next interviews or survey for the major problem. The next one is the causes of mortality, the top 20 in the Philippines from January to December 2021, and 2022. And this is as of February 28, 2023. So maybe we can focus on one of the common problem in the Philippines. Now we have the TB, the pulmonary tuberculosis. No, as you can see, this is one of the major problem, that the top mortality. No, there are roughly around 400,000 cases per 100,000 population. So this congruent to the latest data we have seen in this slide from PSA, the Philippine Statistics Authority. The TB is one of among the top 10 causes of mortality in our country. And this also congruent to the WHO, the World Health Organization annual TB report of 2022. And we can say this is a major problem. So let us see, no, if our interview in Barangay West Crame, na it will be also considered as a major problem. Okay. For the economic cost of the problem, we have the cost of treatment, or the COT. So this is computed as the number of cases times the amount of drugs plus hospitalization plus other medical expenses. So if there is an increase cases, no, there is also a problem. No, the cost of treatment will also increase. Okay. So the next formula is about the cost of disability. So this computed as number of cases times the average number of days lost due to illness times the daily wage cost. So if there's an increase, no, average number of days lost due to illness, there's also increased cost of disability. And the daily wage cost as of December 2023 in NCR is 610. Okay. For the cause of early death, so there is the number of deaths due to the specific cause times years lost due to early death times the expected annual wage. And next, for the cost of prevention, this is equal to the total health budget allotted for a specific disease divided by the disorder. The total economic cost is equal to the four stated, no, the previous stated cost, the cost of treatment, the cost of disability, the cost of early death, and the cost of prevention. And for the disability adjusted life years, the DALY, this is equal to the YLL, the years of life lost due to premature death or mortality, plus the years lost due to disability. DALY is most widely used measure and can also be applied across cultures. No? Again, we will combine in one measure the time lived with disability and the time lost due to premature mortality. And for the years lost due to disability, the YLD, we need the three data: the number of incident cases, the disability weight, and the standard life expectancy at age of death in years. So they're all multiplied to get the YLD. And there are two methods of measurement. So we take point prevalence measures of disability, adjusting for the seasonal variation if present, and express them as annual prevalence. The second, the alternative, is to measure the three. Okay. And for the years of life lost due to premature death or mortality, the YLL, this is computed as the number of deaths multiplied the standard life expectancy at age of death in years. And next, the second part of the epidemiologic method for the community diagnosis is appraisal of existing facts. So what information do you need in order to identify factors that may have contributed to the occurrence of the problem? And why do you need this data? And of course, we need the present level of knowledge, what we have researched, the literature review, with regard to the etiology of an unidentified problem. So the important part in appraisal of existing facts is to ask the disease patterns according to person, place, time of occurrence. So let's go back to our example, our case example, the pulmonary tuberculosis. So according to the WHO, the World Health Organization, annual TB report of 2021, so it is now classified as a global epidemic with 10.6 million cases worldwide, and around 57% no, of these cases are male. And for the age group, it is about ages from 25 to 54 years old. And of course, no, definitely the nutritional status is an important risk of having this disease. And unfortunately, Philippines belong to the top high burden countries for TB according to WHO last 2021. And we need to know the characteristics of the disease agent that influence the pattern of the disease. And for tuberculosis, no, this disease is commonly transmitted from or through coughing, sneezing, or spitting, and is also caused by the Mycobacterium tuberculosis. And it is also important to know the occurrence of the disease pattern. So the geographic distribution, the seasonal variation. Again, if we will talk about TB, no, this is global epidemic, no season, so it can occur anytime. Okay. And for the geographical distribution, this is related to the differences in socioeconomic development as well as the cultural differences. It is also related to the environmental conditions and access to health services. So in our country, no, it reveals that the socioeconomic factors of TB, no, usually are the urban poor, no, that with the educational attainment, if it is low, and some people, no, living in a congested place, no, like people deprived of liberty. Okay. For the seasonal variation, the fluctuation of disease occurrence within a calendar year, reflecting climatic changes, the dry season or the dry months and the wet months. For example, in rainy days, no, there is an increased case of dengue, or in rainy days because of flooding, increased case of leptospirosis. So the third part of the community diagnosis, the epidemiologic method, is the hypothesis formulation. So the questions are, what are the possible explanations for the existence and level of the identified disease or health problem? Cite specific reasons or factors which directly or indirectly affect the status of the disease or health problem in the community. Next, are the reasons or explanations given really existent or applicable to the community only or the whole country? And how do you consolidate the knowledge gained in the preceding part, the appraisal of existing facts, to formulate a hypothesis of causation? So, in your assessment or opinion, why do you think is this condition a problem in our adopted community? And what can be the possible contributing factors or the biopsychosocial factors to that medical condition that are evident, no, uniquely evident in our adopted community? Okay, so let's go back again to the TB. No? For example, you're thinking, no, the different reasons so for the spread of pulmonary tuberculosis. So there are certain conditions that could alter the host immunity, the hypothesis of causation. Like that patient maybe have another comorbidities, no, like the HIV, diabetes, malnutrition, or maybe a cancer, no, that can contribute, no, for TB incidence. And of course, the socioeconomic factors are also important, such as the poor living condition, the homelessness, poverty, the tobacco or cigarette smoking, the alcohol use. It can also increase the risk of having tuberculosis. And for the last part of the epidemiologic method of community diagnosis, we have the practical application. So in general, what may be done to improve, if not altogether solve, the identified disease or health problem in the community and in the whole country? And are there existing activities or programs under the Department of Health being done presently to address the problem? So we will go back to our case, the pulmonary tuberculosis. Yes, we have programs or activities, and we have an RA. That is the Republic Act number 10767, known as the Comprehensive Tuberculosis Elimination Plan Act, and that was signed years ago. And if I'm not mistaken, that is signed last 2016. And this law states that government services like screening, treatment, and monitoring of tuberculosis should be free and available for everyone. So it is somewhat for good implementation of that RA. And the people should know that we have free medication, no, for tuberculosis. And for identified prevalent diseases, what specific measures may be applied on the host or population, the disease agent or sources of problem, and the means of transmission? And usually, so for the tuberculosis again, for the host, primary prevention is encouraged, no? There's a healthy lifestyle like having balanced diet, regular exercise, what else? Avoiding or stopping, no, smoking or alcohol intake, no. It can be beneficial for the patient, no, having tuberculosis. And then they are also advised to seek immediate consultation if they have any signs and symptoms of TB. Now we have the cough for 2 weeks. Okay. And what resources in the community may be utilized to address, no, the identified problems? So the roles of us, no, the medical practitioners and allied health professionals, and the roles of community agencies, the LGU, the local government units, and the non-government organization. So for the patients, no, diagnosed to have TB disease, we as professionals, no, we highly encourage them to wear masks, to do immediate consultation if symptoms are noted. And the role of the community agencies is to give, no, free screening and medications, no, provided by, again, the LGU or the national government, and in order to control the spread of the disease, no. And of course, screening of the family members is also required. What preventive measures, the primary, secondary, tertiary, can be done to control the disease or remedy the health problem at the level of the individual persons, family members, and the community? So when we say about the primary, no, the population or the patient has a risk. No, the secondary is having a risk and having a disease. The tertiary is having a risk, a disease, and a symptoms. No, in as a, for the individual persons, no, or individual patient, again, wearing masks, no, proper cough etiquette, and for the whole family members is to do screening, no, if one of the household, no, has a pulmonary tuberculosis. And for the community, no, it is the role of us, no, and the allied health professionals to do layman's lecture. We can do layman's lecture to increase the community awareness of the community. Certain programs can also be done like the pre-mobile x-rays, no, in order to screen possible patients with this disease. And for the summary, no, the definition of the community diagnosis, no, in comparison with the clinical diagnosis. No? So the process of appraising the health status of the community. And of course is our goal to identify the health problem and needs of the defined populations and to plan, implement, and evaluate the extent to which the health members effectively meets their needs. And the importance, no, of community diagnosis, identify and quantify the health problems, and identify individuals or groups in the community who are at the risk of developing the disease or who need health care. And the four parts of the epidemiological method of community diagnosis, we have the definition of the problem, appraisal of existing facts, hypothesis formulation, and the practical application. So as a take-home message, remember the three cases. What do you think should have been done to prevent those scenarios from happening? It is not enough to have the theoretical knowledge and the pharmaceutical prescriptions to promote health and manage diseases in the community. So health practice is a team effort, and you, as a doctor, is the team leader. Let us start by doing the community diagnosis in our adopted community in San Juan, and think of what you can do to explore the community and help as many people in solving the health problems. And with that, good day.